Hello and welcome. You're watching NDTV. I'm Rishika Barwa. India's COVID cases have seen a dip even as daily deaths hover around the 4,000 mark. Many people are now recovering from COVID, but those who are recovering are also being infected with the black fungus or mucormycosis. As cases and deaths related to black fungus rise in India, the government has asked states to declare it an epidemic. And to make sense of these new worries surrounding the black fungus and answer all your questions, we have with us Dr. Randeep Guleria, the head of AIIMS. Thanks so much, Dr. Guleria, for sparing your time and being with us on NDTV. You know, a majority of this very rare black fungus cases are actually being reported here in India. Why is it that the black fungus is more rampant in India?
So that's true that we're seeing more cases than what is being reported abroad, but it's not that it's only being reported in India. It's been being reported in other countries also. The reason why it's being reported more in India, I think, is multifactorial. One is that we continue to be the diabetic capital of the world. So we have a large number of people who have underlying diabetes, and many of them have a very poor control of diabetes because of multiple reasons. Secondly, we know that COVID-19 itself causes a high chance of this fungal infection because it decreases your lymphocyte count, and therefore people who have COVID-19 are more prone to getting this fungal infection. And the third important reason is the off-label or over-the-counter use of steroids. So in our country, unlike the West, you can buy any drug from a chemist shop without any restrictions. And that itself has led to a lot of people self-medicating themselves or using prescriptions from, let's say, the friendly neighborhood person who will prescribe steroids, and then they land up taking steroids. Their sugars become very high. In the background of COVID, that is leading to this huge number of cases of mucormycosis that we're seeing. So we were seeing this occasionally in the pre-COVID era in patients who were post-transplant, who were on chemotherapy, or who were basically diabetics with poor control.
Right.
Mucor of the lung and of the sinuses was being seen, but now it's really being seen in a huge number.
Why has the black fungus emerged in the second wave of COVID in India? We didn't really hear of these cases in the first wave. Can we therefore link it to the variant strains?
So we did see it during the first wave also, but the numbers were much smaller and therefore it didn't really cause that much of a concern.
Right.
Because the number in the second wave are much larger in absolute terms, in terms of patients, but also because I think the use of steroids has become much more excessive in the second wave than what it was in the first wave. And that is also contributing to this huge number in terms of the black fungus that we're seeing.
Dr. Guleria, majority of our questions from viewers, are around black fungus because it's relatively new to most people. How does a black fungus spread from an infected person to a healthy person? Is it airborne like COVID?
So it is not contagious. So if you have a person who has black fungus or mucormycosis in the sinuses, it's not that it is going to spread to another person in the neighborhood. So unlike the precautions that we advise as far as COVID is concerned, those type of precautions don't need to be taken as far as mucormycosis is concerned. The predisposing factors are basically, like I said, poor control of sugars. So anyone who has underlying diabetes should get his sugar regularly checked and monitor his medication so that it can be adjusted according to his blood sugar. Second issue is, of course, to be careful about the dose, the duration, and the indication of steroids if you're taking them for COVID-19. And the fungus is found in the environment, in soil, and at times it is there. It is a fungus which can at times be normally present as a commensal, as we say sometimes in the nose, but it doesn't cause invasive infection unless you have these predisposing conditions.
Right. Important. I'll ask you this once again. Is it a communicable disease? Can an infected person pass it on to a non-infected person? Because that will really help people in dealing with, anyone who has black fungus.
So it is not a communicable disease. It is not transmitted from an infected person to a non-infected person by close contact or by coughing or droplets. It is basically present in the environment. And if you are having a predisposed condition, then you are at a higher risk of getting it.
Right.
Again, it's not that everyone who has these will get it, but because a large number of people are now having COVID. Many of them are diabetics and many are getting steroids. The number is more, but it's not that everyone who is a diabetic and everyone who gets steroids is going to get mucormycosis, and it is not incommunicable.
Okay, very important clarifications there. Dr. Guleria, unhygienic oxygen therapy, is that something that could lead to the spread of black fungus? What should patients be watchful about? And are there any special precautions that need to be taken in cases of home isolation?
So initially it was felt that this was occurring only in people with oxygenation, but if you look at data from various states, many people who have got it while they're at home without taking oxygen.
Right.
It's happened in individuals who have been on steroids at home without taking oxygen and have then gone on to develop mucormycosis. So oxygen is not a risk factor, and there's been some unfounded news that it is basically because of industrial oxygen. That is also not true, because most people who got it have got it from places where medical grade oxygen was being given. It has been recommended that the tubing should be properly cleaned. So if you're using tubing for your oxygen at home, or if you're using oxygen at home, the tubing should be cleaned properly. You could use sodium hypochlorite, or even using a disinfectant, using a tub, put the tubings in that tub and keep it for some time so that it gets sterile, and then you can wash it with water and then use it. The water that was used for humidification, just to be on the safe side, one would say that use sterile water rather than tap water. But there is again not much data to suggest that that is a risk factor as far as mucormycosis is concerned.
That's an important clarification, because you're saying that even in patients who were not necessarily on oxygen therapy, even those patients have been diagnosed with mucormycosis. You know, you've talked about the use and abuse of steroids and, you know, off-the-counter self-medication use of steroids. The question, therefore, is, are there any particular steroids that we know of, Dr. Guleria, that may be causing mucormycosis, and can they be avoided?
So steroids are a broad group, and we have drugs like methylprednisolone, dexamethasone, prednisolone, deflazacort. All of them are steroids, but they all are having a predisposition to cause black fungus. It's not linked to one type of steroids as compared to the other. What it is linked to is the dose of steroids. If you're taking a very high dose of steroids, the chances are higher. The levels of your blood sugar and the duration of steroids. Mucor can also occur in people who've taken steroids for a shorter duration, but it's much more, the chances are much more if steroids are taken at a higher dose and for a longer period of time. So what we really advise people who need steroids is to take a low dose of steroids, a mild to moderate dose rather than what we call a pulse dose. Take it only for about 5 to 10 days. The data does not suggest that you need to take steroids for weeks or months, as far as COVID is concerned.
And are only COVID positive patients at risk, especially COVID positive patients with a history of diabetes, like you were saying?
So what we are seeing is that in 90 to 95% of patients that we are seeing, it's predominantly those patients who have had COVID, have underlying diabetes, and also have taken steroids. It's very, this combination is the one which is contributing to bulk of the patients. Like I said, mucormycosis was also occurring in the past in people who had diabetes and who did not have COVID. But the combination of COVID, which predisposes to this fungal infection coming up in a big way, the use of steroids and poor control of diabetes, all three have actually led to this outbreak of mucormycosis that we're seeing in our country.
You know, an allied question, because we're talking about diabetes patients, you know, it's also said that those immunocompromised are at a higher risk. What defines who is immunocompromised?
So immunocompromised are those people who, because of their predisposing condition, are taking drugs which decrease their immunity. And this could be cancer patients who are on chemotherapy. So chemotherapy is one, because you're giving these drugs, your immune response is abutted. Post-transplant patients who are given drugs to decrease their immune response so that they don't have a rejection. These are the type of patients that we're talking of. And of course, those who are having certain other chronic immune disorders for which they have to take drugs to decrease their immune response.
So are these also high risk category then for black fungus?
So they have been a relatively high risk for fungal infections even in the past before COVID, and therefore they were the one that we were monitoring more closely for fungal infections. and at times they were given some prophylactic treatment also. Currently, if this group also gets COVID and then lands up in having to take steroids, and if unfortunately they also have diabetes, then of course they also become a very high risk group.
Right. Can non-COVID patients get black fungus?
So non-COVID patients can get black fungus, and like I said, we were getting patients with mucor even in the pre-COVID era. That is when COVID was not even there at all. But it was, very occasional. We were not seeing that many patients. ENT people would see one patient a month, if I may put it that way. We were seeing pulmonary mucormycosis in diabetics with poor control, maybe once or twice in a month. Now we are seeing more, almost 10, 15 patients in a day. So the number has changed dramatically, and that's basically because of the use of COVID, the presence of COVID and the use of steroids. So it can happen even in non-COVID patients, but it's very uncommon as compared to what we're seeing right now.
Which age group, Dr. Guleria, is most vulnerable?
So this is occurring in all age groups. Middle-aged people are also vulnerable. We're seeing it in younger age group also, and the older age group. It's more in the relatively older age group, 40 and above, because that is when a large number of people who have diabetes are being seen. So comorbidities like diabetes tend to happen more in the older age group, and that's why it's being seen more in that age group.
What about children? Are they at a risk of mucormycosis? There's been this case of a 15-year-old who was infected and had to undergo surgery.
So children are at a relatively lower risk because of the fact that unless they have what we call insulin-dependent diabetes, which can happen in children per se, by and large, we're not seeing it that frequently as far as children are concerned, because majority of children have mild infection as far as COVID is concerned, and most of them really don't require steroids. They just require symptomatic treatment. And we know that diabetes is not as common in them as compared to the older age group.
Right. What are the early symptoms of black fungus? We know that there's a long exhaustive list of symptoms that has been listed by the government, but what are the early telltale signs that people should watch out for?
So if you have headache, which is more than what you would otherwise get and it's not getting relieved, if you have crusting in your nose, you feel that your nose is getting blocked and there's crusting, and there is sort of swelling on one side of the face. So it's not a swelling on both these sides, but it's on one side of the face, and you feel that there is decreased sensation on one side, then those are early signs that you should really start worrying. You should, if you find that there is some blackish discoloration in the mouth, or there is some loosening of a tooth, then also you should immediately consult your doctor.
Is there any test for it, or is there only a clinical diagnosis?
No, there's definitely tests for it. There are two things that we do. One is that we would also look for a X-ray or a CT scan of the sinuses to see whether there is infection in the sinus. And the secondly is you could take a biopsy. You will do what is known as a nasal endoscopy. You will look into the nasal passage and then take a scraping or a biopsy from that area.
Right.
You can do a staining which is known as a KOH staining to look for the fungus in that staining. And then you can also do cultures. There's also a blood test which can be done, a PCR-based test, which can help in getting a diagnosis as far as the blood is concerned.
Okay, Dr. Guleria, a couple of quick questions on precautions. We know that this is found in the soil, so should gardening be avoided at a time like this?
Well, if you have COVID and you're a diabetic, yes, you should be inside and not be outside and do gardening. But I don't think I could say that there is a lot of data to suggest that gardeners have it more as compared to those who are not gardening, unless they have the other comorbidities.
So if you have COVID and diabetes, you need to stay away from your plants, at least temporarily. Any special precautions while handling fruits and vegetables at home?
So while handling fruits and vegetables, it's not that you can get black fungus from that, but I would say that the general precaution that we advise for any to avoid any droplet infection, that is, you wash your fruits and vegetables properly in warm water, and then once you've done all of that, wash your hands properly, would also imply as far as this is concerned.
Right. What is white fungus, Dr. Guleria, and is it more dangerous?
So we're now hearing of this white fungus, and it seems that this is another fungal infection which is being reported by some people, which is more likely to be what we call Candida. Candida is a fungus which leads to white coating of the throat and the food passages at time. It can also lead to other parts being involved. If it spreads in the blood, sometimes candidemia or candida infection can be serious, but there are other drugs which we have for it. It's not that much of a concern right now, unlike mucormycosis.
All right, but this white fungus is also related to COVID at the moment, or the increasing cases related to COVID, or it's a separate issue altogether?
No, it's not. I don't think it's related that much to COVID. White fungus, candida can occur in people whose immunity is low, and they can get what we call an opportunistic infection, which can be candida.
Right. All right. I think that answers most of the frequently asked questions on the issue of black fungus, the precautions you need to take, the early telltale signs. We're going to slip into a very short break. On the other side, we'll address some of the other important questions that India is facing right now. We'll slip into a short break. Dr. Guleria will be live with us on the other side. Stay with us. Welcome back. We are in conversation with Dr. Randeep Guleria. Dr. Guleria, India's cases have seen a dip, but deaths continue to rise. Can we say, as the country as a whole is past the peak of the second wave?
That seems to be the case, especially as far as the western part of India and central India is concerned. We seem to have now a downward trend for the last few days, and it seems that we may continue with this. Concern, of course, rise in southern India and eastern India, where cases still are rising, and hopefully they will sort of plateau and come down in the next few days. If you look at the country as a whole, the cases do seem to be on a downward trend.
And the rising number of deaths?
So that is a cause of concern, and I would say that we are seeing more deaths now than what we were seeing in the past, and we need to really look at it critically as to what could be the cause. Is it related to the variant causing more severe cases with more lung involvement?
Right.
Or is it related to some degree of delay in people coming to the hospital, relying more on home treatment or home isolation and taking oxygen at home, and then when the saturation really becomes too low, crashing in when they reach the hospital.
Right.
So there needs to be in each state, in each hospital, a death audit to just see what could be the cause and how can we really decrease our death rate so that we are able to bring this down.
Right. Daily vaccinations are way below the target. How can India deal with this acute shortage of vaccinations?
So there are multiple steps which have been taken, and I hope that in the next few days or weeks we will be able to see the outcome of that. One is, of course, the Sputnik vaccine now being rolled out, and therefore that adding to the stock. Second is the manufacturers of both Bharat Biotech and the Serum Institute setting up new manufacturing plants which will operationalize, and therefore the doses available will become much more. One is very hopeful that international vaccines which are available, especially Pfizer and others, will also be now coming into India, and that will also help to increase the vaccine pool. So I'm confident that maybe in the next few weeks' time, we will have more doses available because we desperately need them. One of the strategies that we have is to vaccinate as many people as we can. First, of course, based on the priority so that mortality comes down, but then even the others, because that will help to decrease our mortality and break the chain of transmission and thereby decrease the number of cases.
Delhi and Mumbai both have seen positivity rate of below 5%. Can the lockdowns in these cities or in other areas which are seeing a positivity rate of below 5% be lifted?
So in my opinion, there are two factors that we need to look at. One is, like you said, a positivity rate which is consistently below 5%. And secondly, data which suggests that at least 60 to 70, that you have at least 30 to 40% of beds which are reserved for COVID now becoming vacant. Because what happens is that you may have still a large number of patients admitted, and you don't want to really lift the lockdown too early and then have another surge and have no vacant beds. So both availability of beds and a consistently decrease in the positivity rate to less than 5% would be factors which could which could sort of encourage a graded lifting of the lockdown.
And what would explain the positivity rate in these areas dipping despite, a really dire situation that we've seen in several cities?
So multiple factors. I think one factor which has really helped in these cities is been the containment or the limited lockdown that these cities had. That has really helped in breaking the chain of transmission. Because if you are able to bring down a lockdown and aggressively impose it for about 2 weeks at least, then you are able to break the chain of transmission, because that is the incubation period of the virus. And therefore, if people stay at home, are not allowed to go out for work, and only essential activities are allowed, then the number of cases will come down. The challenge, of course, is to sustain it, because if you open it up dramatically, you may land up with another surge happening, and therefore you have to do it in a manner that COVID appropriate behavior is maintained,
Right.
and you balance what we say lives versus livelihood.
All right. Dr. Gulere, an interesting study in Spain has shown that a combination of the Pfizer and AstraZeneca vaccine is actually safe. And if you've got a shot of AstraZeneca and you get the second shot of Pfizer, it's actually more efficacious. Do we need to explore these possibilities as well?
I think so, and research is being done looking at various combinations. It could be the AstraZeneca vaccine and the Pfizer vaccine. It could be AstraZeneca and Sputnik, or these studies were being done in UK also. And there could be other studies done, because the hypothesis is that if you are getting vaccine from the shot is from using one platform, and then subsequently you give another vaccine which uses a different platform, you may actually have a stronger immune response,
right,
which may lead to more antibodies being formed because of different platforms being used to form the same type of antibodies which are against COVID-19. The other advantage, of course, is that it allows you to give larger doses, because you can mix and match, and therefore, depending on what is available in a given area, the vaccines could be given in that manner. I think we need more data, and I'm confident that in the next few weeks we will get more data even from these studies being done in the UK. But this is an interesting concept which needs to be explored, because this helps us both from the public health point of view and may also help in giving a bigger boost as far as the immunity is concerned.
All right, Dr. Gulere, very last question. Children will be worse hit in the third wave of COVID. This is something that's been talked about. Is this a fact or a myth?
I don't think we have enough data to say that children will be worst hit. For when we look at the number of children affected in the first wave and even now in the second wave, most children have had a mild illness and have come out without significant mortality.
Okay.
The serious cases that we've seen in our hospital are those who have underlying comorbidities like underlying cancers or immunosuppressed state. But healthy children have actually done well. And I see no reason why that should not be there in the coming months also. So even if we say that more children will get the infection, I think most of them will get a mild infection and will not have a serious problem.
All right. One sincerely hopes that is the case. Thanks so much, Dr. Gulere. I'm afraid that's all we have the time for. Thanks so much for tuning in.
Thank you.